Welcome PSY 364 students. This is our second week, and it's the Thanksgiving week, in which we look at extreme behaviors in men and boys and its relationship to clinical diagnoses this week, professional and non-professional sports next week, and then last week is simply looked at in its own right. I wanted to make this a 3-week block of investigation so that we don't make the mistake of medicalizing extreme behaviors prematurely, and that we accomplished last week as we looked at the behavior of men and boys and their becoming both heroes and evil males. And we know that both extremes are possible, and there's a theme in the literature that links the two called expendable males. And I think it's an important part of the psychology of men and boys that we should look at. So this week we take a more traditional look at the intersection of clinical diagnoses and the behavior of men and boys. And I have two particular goals, largely similar to those in Kilmartin and Smiler. One is that we acknowledge that some diagnoses are disproportionately associated with males, and then the second is to look at the possibility that psychotherapy and psychological interventions can be better adjusted to account for the distinctive needs of men and boys. So, all of that being said, just a warning, first of all, this area is difficult, as I mentioned last week, and complex, and so we won't get to the bottom of these issues in this course. However, we will be able to hopefully deepen the understanding of the students who are now close to completing the course. So as we look at the clinical aspects, again, the first goal is to look at clinical diagnoses and identify those which are disproportionately associated with males, and then ask, how do we understand this correlation? Remembering that correlation is not a cause. We also want to look at what we know about the strengths and limitations of many males, and ask the question, can we better rethink our approach to clinical interventions so that they're more effective and engaging with men and boys? Those are the two fundamental questions for this week. Okay, that's a brief introduction to this complicated area. So I'm going to leave it there because I really want you to take some time for Thanksgiving and to keep this particular focus in proportion to the time that you have. Probably the most important thing now is your course project. So I strongly recommend that you simply not dash off a show and tell essay of some sort, but rather consult with me so that I can help you make a research paper that is useful and in keeping with the social science practices of being a true research paper. So give me a call. Time is getting short. Make sure your plans for Workshop 3 are in your calendar. And remember that you need to post those plans in Dr. K's office on the discussion board. And also, if you're concerned about your grade in the course, now is the time that we should talk in real time, not by email, but on phone or face-to-face, so that we can work together on what I call good endings. I'm committed to good endings to students who persevere and want to succeed in the course. But we need to have some real-time conversation, review where you are, and what your options are going forward. If there are students in difficulty, I am open to the possibility of extensions when there are unusual circumstances, but I can't do that without your reaching back and our having a real-time conversation. So I'll close this 5-minute video simply saying, do have a happy Thanksgiving. Certainly do take the time to savor those things that are going well in your lives and in your studies, and sort of regroup for the last 3 or 4 weeks that await us when we return from the holidays. Thank you.